In this PowerPoint, we will cover the overview of methods and strategies in parasitology. And so this will basically be a short introduction to parasitology and the laboratory portion of it. Parasites of humans are classified as protozoa, which are unicellular eukaryotic cells. And we have the metazoan helminths, and these are the worm-like cells, so you have your roundworms and your flatworms. And then you also have arthropoda. We're not going to cover these, but these are like your hard shell insect type organisms, so like your fleas, your ticks, things like that. And so you have several of these that can actually transmit parasitic type infections. So these organisms can be transmitted through venereal type transmission, so through sexual type transmission. They can be ingested, and this can be through contaminated food and water. They can also penetrate the skin with the infected larva or the eggs of the organism, and they can also enter through the bites of different arthropods, so through like your ticks or fleas. So the disease states of these organisms with these infections can range from mild to serious, or they can even be life-threatening. But a lot of times some of these organisms will reach a point of status quo with the host where they kind of have a mutual relationship of respect where neither is destroying the other. They just kind of coexist. And you can have one, some, or multiple body sites that can be infected. And so the organism can actually infect various organs, not just one particular organ. And then the life cycle of these parasites are very important to the pathology. So with this life cycle, it helps with their reinfection as well as their survival, and as well as like when it actually will infect the host. Some of them can only infect the hosts with eggs versus where others need to infect the host directly. The samples for these organisms are transported immediately to the laboratory, and sometimes with preservatives. So if it is a sample that's going to take a while to reach the lab, then it usually is put into some sort of preservative, because these preservatives will maintain the morphological characteristics of a lot of these organisms and the eggs of these organisms. The processing depends on what's actually used. You have different fixatives that are used. So you have some fixatives that are used as soon as the sample is collected, and then you have others that may be added a little bit later. And so the processing of the collection of these specimens is important to make sure that you maintain the stability of those organisms. And then you have some situations where the sample needs to be processed immediately. So as soon as it's collected, it needs to be taken directly to the lab to prevent that organism from deteriorating. And so an example of this would be like a spinal fluid collection where you're looking for the free-living amoeba, and also blood films that could contain something like malaria. And then with your fecal samples, sometimes you have a two-vial collection system where you have one vial that may have formalin in it where you're going to do the immunoassay testing, and then the other vial may have the PVA, which will assist with making stained smears. So for the preservation of those particular eggs or cells that are in that sample, to allow it to be able to be visualized on a microscopic stain smear. With processing these organisms, depending on the method that the laboratory uses or what they're particularly looking for, formalin is used for the fixation of the eggs, the larvae, the oocysts, and the spores. Whereas trichrome stain for making a smear is used to distinguish a cyst from a trapezoite. And then you have the modified iron stain that will help you to visualize the cysts and trapezoite. And then you have modified acid stain that are more specific for reviewing your coccidia type organisms. And then you also have modified trichrome stains, which helps to differentiate your microsporidia. And so with these type stains, you're looking for the organisms, depending on the stain, to either be the green color, a blue color, or some of them even have like a pinkish red color. With microscopic examination, this involves looking at the specimen on a slide with different microscopic magnifications. So you could look at it on low power or high power, even oil. And so depending on the size of the organism, you need to be able to look at the slide on these different magnifications to make sure that you don't miss anything. With intestinal tract samples, the stool is submitted for processing if the provider suspects any sort of parasite or intestinal tract, parasite of the intestinal tract. And other specimens that could be submitted would be different aspirates or mucus, or samples that are collected during like a sigmoidoscopy. And so for this, you're doing OMP, in which you're looking for the ova and parasites. And so with this, you would do direct detection methods. So when you're just looking at the sample directly, like with a wet mount, or it could be concentrated, so it could be spun down, making sure that you get the sediment at the bottom, or there are some eggs that will actually float, so you might get the flotation of those eggs off of that sample after it's spun. And you can also make permanent stains to view for some of these eggs and organisms. You can also do recover some of the, like a tapeworm, part of the body of the tapeworm, and view that under the microscope. Or you could look directly for like pinworm eggs through a pinworm prep. And then there's also immunoassay and molecular techniques. So these are some more your more automated methods that you could do this, as well as some of your kit testing. So with pinworm examination, they do the sticky paddle or the Scotch tape prep. And so with the sticky paddle, it does have like a tape-like residue on the paddle, in which you would stick between the cheeks of the child and look at that paddle to look for those eggs. With the Scotch tape prep, you use the sticky side of the Scotch tape to apply to the inside of the butt cheeks of the child, and then from there you would put that onto a glass slide, and then you're looking for those eggs of the pinworm. With your urogenital tract specimens, you're looking for the organism on a wet mount preparation, and you're looking for Trichomonas to be alive and moving, swimming around in that specimen. So you're looking at this on low power to see if you see any of that movement. And you can also see these organisms in urine specimens as well from the cross-contamination. And then there's also direct testing methods of like an antigenic type testing method with different serologies or kit testing, where you're actually testing for a positive and negative result for this organism. With sputum, you rarely see parasites in sputum, but there are some organisms that you can find within sputum. And so with this, it's usually these organisms are going to cause some sort of pneumonia type infection, or a syndrome in which the patient will produce a lot of eosinophils. And so there are several organisms that you can find in sputum, and so we will talk about those in more detail a little later. And so with collecting sputum, you are, once it's collected, once the patient is able to produce it, cough it up, then the specimen would go through a preparation process in which it goes through a decontamination to leave just the parasites and not anything else that may be in there, like fungi or the bacteria that may be in there. With aspirates, these are your liquid specimens. So this could be some sort of like fine needle biopsy or bronchial lavage or wash, a bone marrow, spinal fluid. And so with these specimens, they would be submitted in a liquid form to be processed. And of course you have biopsies, because there are some organisms that do penetrate tissue, so you may have to do some sort of pathology tissue type sample to look for these organisms within that sample. So it could be some grinding of the flesh to be able to help better visualize some of these organisms as well. And that's kind of the same method that goes with your mycology, where the specimen of the tissue is actually ground up or minced so that it helps to release those spores. And so with a biopsy specimen, then it may be that the specimen's got to be sliced down to be viewed as like in this image here. With the blood specimens, you would view this under the microscope, making thin smears and thick smears. And so this is just a technique that the laboratory uses to help visualize some of these organisms depending on the particular organism and how it's viewed. So it could be made into like a thin smear or a thicker smear, where the technician will look up under the microscope to see if they see any of these organisms, and they could stain the slide with the right stain or Giemsa stain. With the right stain, this is just the typical stain that's used in your hematology department for your differentials. So that stain's a pretty common stain, so it's pretty easy to order and perform this test in the laboratory. And then there's also a Buffy coat technique, in which the technician will strategically make a smear using just the white blood cell platelet layer of the blood, and that looks for specific organisms that could actually infect inside of the white blood cell. And then there, of course, are different direct detection methods that are more automated, or a serology type method with like a rapid kit test, so something similar to a pregnancy test. And so there are a few out there that detect some different organisms. And then with your blood parasites, there are some different methods of automation that will detect those well. There are a lot of new analyzers that are starting to come out, especially from like malaria, looking for those antigens of that organism in those samples. So there are some preventative measures that can be taken to prevent parasitic type organisms. So this would include personal hygiene, proper sanitation, avoiding sexual activities that could cross-contaminate with contaminated fecal matter. There are preventative measures for malaria, so there a lot of the military do get these, or people that are going overseas on mission trips will do the chemoprophylactic agents for malaria. And of course, preventing any sort of vector transmission, so like through your tick bites, bug sprays, things like that. Adequately preparing meals, cooking your meats adequately to make sure that you don't ingest the parasite that may be in the muscle tissue of the meat.